Okay, today I'm just going to go through how to take out sutures and staples. The first thing you would want to do is make sure you have a doctor's order to take out the sutures or staples. Sutures and staples should be taken out anywhere from 7 to 10 days with the doctor's order. So anticipate that that's going to happen. I would come into the room, I would identify my patient, I would wash my hands, and I would put on gloves. If the patient has a dressing over the top of their sutures or staples, you would take that off. Not always is that the case, but if you would take that off. If there's any exudate on there that's pourable, drippable, squeezable, or flakeable, you would have to put it in a red biohazard bag. So the first thing I'm going to go through today is how to take out sutures. And again, the first thing I'm going to do is assess my wound. And again, the edges look approximated, which means they're close together. There isn't any type of dehiscence or evisceration, meaning pulling of the incision apart or any organs coming through. It actually looks really good. There's no redness, no signs and symptoms of infection, no swelling. I'm going to open my suture tray here. Within the suture tray, you will have a tweezers, a scissors, and a 2x2. You always want to take the scissors in your dominant hand and the tweezers in your non-dominant hand. You want to come and tell the patient that it's going to pull a little bit, but it shouldn't be painful. You're going to grab the knot with the tweezers, and you're going to come most distal to the knot, and you're going to clip that suture, and you're going to pull that out, and you're going to put it on your 2x2. You're going to want to take out every other suture just to make sure that your incision stays close together, okay, or approximated. So we're going to take out every other one. Again, most distal, so that none of that contaminated suture that's been out for the last 7 to 10 days goes underneath the skin, which could cause an infection. And you're going to try to keep the tip of the scissors as aseptic as possible. And the incision looks real good. Okay, everything's staying intact. We're going to take out the other ones that we didn't take out. We're going to keep them on the 2x2 because we want to count them when we're done so that we can document. Good. Everything looks real good. So the next thing we're going to do is we're going to open up some skin prep, which actually helps the steri-strips stick better. Some surgeons like to use steri-strips. You would need an order to use steri-strips. Other surgeons don't. So again, follow your doctor's order. And again, this is an ampule that breaks, but because this is foam, I don't want to do it on the foam. So I'm going to just come right next to it and kind of just make 2 little passes, and I'm going to turn it over, and I'm going to just go on the other side. Not on the incision at all. So I'm kind of just putting it so that the steri-strips stick better. I'm going to allow that to dry, and I'm going to open up my steri-strips. Okay. Your steri-strips actually have an area that has an edge on it that you can actually take off, and you can see the edges are kind of up like that. And we're going to just take one steri-strip at a time. We're going to just put that down, and we're going to maintain aseptic technique to make sure that the steri-strip that goes over the top of the incision stays as sterile as possible, or aseptic as possible. We're going to take the next one, we're going to tip that upside down, we're going to go up just a little bit, and we're going to continue doing that all the way up until the whole area is closed. Okay, so for demonstration purposes, I'm not going to go all the way up, but you would go all the way up the incision with the steri-strips. You would let the patient know that these steri-strips, that they shouldn't pull them off. They can take a shower with them. The edges will just curl up. They can cut the edges off, but they should never pull them off, and they'll just fall off in a number of days. Okay, the next thing I'm going to do is I'm going to show you how to take out staples. Again, the first thing we're going to do is we're going to look at our wound, make sure the edges are approximated, meaning close together. that there isn't any signs and symptoms of infection, any exudate that's coming, any swelling, any redness, any warmth in any area. Again, double checking, make sure we have our doctor's order and everything looks good. So we're gonna, again, if you had another patient or the same patient, you may want to change your gloves in between time if there was any chance that your gloves were contaminated. So we're going to open our staple removal kit. And again, you're going to notice with the staple remover kit that there's one side that has 2 prongs and one side that has just 1 prong. It's the side that has 2 prongs that are going to go underneath.
Okay, anytime.
Okay, so I open up my staple removal kit, and you're going to look at the prongs, and on the bottom you want the 2 prongs, and on the top you have 1 prong. So when you actually go underneath the staple, you're going to go underneath with the 2 prongs. Okay, so you're kind of going to do the same thing we did with the sutures, is you're going to go every other one. You're going to kind of go at an angle here to go underneath, and then once you're down, then you're going to almost be parallel with the skin, and then you're going to pull it up, and it kind of just comes up, and again you're going to put it in your kit off to the side, and we're going to do that with every other one. So we're going to kind of go at an angle, and we're going to flatten out, and we're going to kind of pull that right on out of there. And again, this doesn't hurt, but sometimes it pulls a little bit. Again, we're going to do, kind of move it back and forth a little. It comes out a little bit easier. Good. And again, if they have a low pain tolerance, you may want to give them something for pain maybe 30 minutes before you do this. And again, the wound edges look approximated. Nothing looks like it's pulling apart. So we're going to go ahead and take out the other sutures or staples. Again, you're looking for the evisceration or dehiscence. And I like to put the staples in here because I end up putting them into a sharps container, because again, those staples edges are sharp and they could poke through even a biohazard bag and poke somebody even in maintenance to have them have an exposure. So we don't want that to happen. So we'll actually be putting these into the sharps container. So after I have all my staples out, I then can do my skin prep again per physician preference. We're going to do the prep again, and again, this is an ampule, so you'd crack it. It sounds like glass breaking. And another way to do this is kind of to just go side by side, side to side, and just go all the way down the incision like that. Okay, and same on the other side. We would remove this dressing and we would go side to side, all the way down, and we would allow that to dry. Once that's dried, then we would open our SteriStrips. And again, these are actually, there's 2 separate packages. So again, we're going to take this off, and we're going to just take one at a time, and we're going to go over the top of the incision, maintaining sterility of the middle of the SteriStrip. And we're going to just go up, and I'll just put one more on for demonstration purposes. Good, but we would go up the whole incision. The last thing we would want to do is do our documentation in our nurse's note. Make sure you document the site assessment. You would also want to document how many staples or sutures you took out, that you actually applied the skin barrier, that you applied the SteriStrips, how well the patient tolerated it, and make sure to initial and sign your name at the end of your nurse's notes. And that's how you take out sutures and staples.